Okay, we will get started. Hi, everyone. My name is Alicia Elias. I am here with Stilly Valley Health Connections. I want to thank you for joining us tonight for the Overdose and Narcan training. For everyone joining us live, please note that this class is set up as a Zoom webinar. This means that all participants are muted and your videos are turned off so we can record the presentation. If you would like to leave any questions or comments, we encourage you to do so by using the chat or QA box at the bottom of the screen. Thank you for being here, and thank you to everyone who has joined us for this class so far. Now I will pass it over to Amy, who will be presenting today's topic. Thank you.
Thanks, Alicia. Hello, everyone. Thank you for being here tonight. As Alicia said, my name is Amy Wheat. You are here for a Narcan training. Um, I am the opioid outreach specialist with Snohomish County Human Services. I work in behavioral health and will be providing your training tonight. Tonight, we're going to talk about what is Narcan or naloxone. We'll talk about what opioids are and how they work. We'll talk about the overdose problem, mainly what's going on here in Snohomish County, but briefly nationally, what things are looking like. You will learn how to recognize and respond to an opioid overdose in this class tonight. And we will also talk about fentanyl. We'll go over the Good Samaritan naloxone law for Washington State. And then the best part is talking about how you can get Narcan. So it's a little different since we're doing a virtual training. I do want to share that I will be providing Narcan to anyone who would like to pick it up from Stilly Valley Health Connections. That will be available next Tuesday afternoon. So I will drop off kits if you are interested and would like to stop by and pick one up. They will be there for you free of charge. So starting out, what is Narcan or naloxone? So Narcan is the brand name of naloxone. It is the same medication. The only thing that this medication does is work to block or reverse the effects of an opioid overdose. So anyone can use this medication. There is an injectable form. Tonight you're being trained on the nasal spray. Um, and like I said, the only thing that it does is work to reverse or block the effects from an opioid overdose. Back in March of 2023, the FDA changed this medication from being sold from behind the counter at the pharmacy to over the counter. So this sounds like a great plan. The problem is that prior to it becoming an over-the-counter medication, if you were to walk into the pharmacy and ask to purchase a Narcan kit, it would cost between $125 and $160 cash. Now, you didn't have to have a prescription for it back then. It was basically like a blanket prescription that was written by the health officer for Snohomish County, would basically write like a big prescription that anybody could access Narcan. But there was a stigma-inducing part to that where people had to still ask the pharmacist to get it. So the idea again was to limit stigma, create more access for individuals to get this medication when it became an over-the-counter medication. What we've seen is the price point has come down. If you were going to go to Walmart or your local pharmacy, uh, if you were going to get on Amazon.com, you could order a Narcan kit and it would be about $45 to $50 cash. So the price has come down from what it was, but it still is expensive. That's just something to keep in mind. So if we were all together in a room, I would ask you this: why do you think that Snohomish County has an opioid outreach specialist? Um, well, there's a lot of reasons. We all know that there's been an opioid crisis and epidemic going on throughout our country for several years. Back in 2015, Human Services partnered with every law enforcement agency in Snohomish County and provided them with a Narcan kit. So, what happens when you call 911 is typically law enforcement is first on the scene. The idea was to equip officers and deputies with Narcan so that when they arrived, they would be able to administer this medication and help save someone's life. This was a 1-year pilot project that actually went for 5 years because it was so successful. There were over 300 lives saved just by law enforcement being first on the scene and administering this medication. So back in December of 2020, the program shifted from Human Services over to the Snohomish County Health Department. So law enforcement officers and deputies do still carry Narcan. It's just not run through our division anymore. What they're finding though is what happens when law enforcement would show up and arrive to someone experiencing an overdose. They'd administer the Narcan. What happens? What happens? What does the person do? Um, a lot of times, they go back to where they were when the overdose occurred, right? So, my role was created to work with individuals who might be interested in doing something different. So, if they were looking for maybe detox or treatment options, if they were experiencing homelessness and looking for housing. Again, just having a liaison to help navigate through the system of what those next steps could look like for that individual. So I work with Snohomish County Sheriff's Department. Our Human Services is partnered with multiple law enforcement agencies throughout our county. We are referred to as the Scout Team, which is Snohomish County Outreach. There are 9 social workers on our team, paired, like I said, with different law enforcement agencies throughout the county. So I do have a caseload. I work with individuals who are struggling with opioid use disorder. Um, but the second part of my job is being able to provide education and training on how to administer Narcan. What I've learned in this position is that lack of education produces a stigma, and there is a huge stigma surrounding opioid use disorder and actually what's really going on in our communities. So this is something that I love to do, is to be able to have conversations and talk to people about what's really actually going on out in the communities. So, what are opiates or opioids? They're a class of substances that are analgesics. So that means that they block pain signals when you use them. But with that, they also create a depressant effect and a euphoric effect. But what's the difference between an opiate and an opioid? They do the same thing in our brain. They sit on the same receptors in our brain. The only difference is that an opiate is a drug that is derived from the opium poppy plant. So codeine, morphine, heroin, and opium are actually created and made from the opium poppy plant. An opioid is either a full synthetic or a partial synthetic drug that is manufactured in a lab. So medications that we're prescribed or take, Percocet, Oxycontin, oxycodone, fentanyl, all of those drugs are considered opioids because they don't require the opium poppy plant to be made. They're made out of the chemicals. When we're talking about drugs that are not opioids or opiates, that's going to be methamphetamine, cocaine, ecstasy, marijuana, benzodiazepines, which are also the class of drug that is a Xanax or Valium. Those drugs are not opiates or opioids. And the reason it's important to know that is that if you were to come across someone who was experiencing an overdose on, say, a Xanax, and you gave them Narcan, it's not going to help them. It's not going to do anything to help reverse their overdose. Now, it won't hurt them in any way because this Narcan medication is very safe, but it's not going to do anything in regards to helping them with the overdose. So, how do people use opioids? Both prescription and non-prescription opioids can be orally ingested, smoked, snorted, or injected. When we're talking about prescription opioids, when we use them as prescribed, the effects will be predictable. So if you get a prescription from your doctor to take an opioid, they take the information into account, such as your height, weight, any other medications that you're taking, or any medical conditions that you have. And then based on that information, they can predict how your body will respond to that opioid. It's when we take a prescription opioid that was not prescribed to us that the effects would be unpredictable. So if you are going to a friend's house and you're there and you're complaining of a horrible headache, and your friend says, "Well, I have a prescription of Vicodin for my headaches. You're welcome to have one." Your friend is not trying to harm you in any way. We know that. but they have no idea, and you have no idea how your body will respond to that opioid, right? So that therefore makes it unpredictable. When we're talking about non-prescription opioids, especially street drugs, the effects are always going to be variable. We will talk, like I said, about fentanyl and what's going on in our street supply right now, but there's no way to know how much you're getting or what you're getting and how your body will react to that. So, who uses opioids? Yes, we know a person with a substance use disorder, but also someone that's just had surgery, or someone that struggles with chronic pain, or other dental issues, or medical issues. All valid reasons, right, to be given a prescription. But who can overdose? Everyone. I mean, even though we just talked about our doctors being able to predict how our body will respond to an opioid, it's still a dangerous medication and it needs to be managed carefully. So again, family members or friends that use prescriptions not intended for them. Kids that think that medication looks like candy. This is a big one. This is always very prevalent around Halloween, especially in the media where they talk about, you know, candy that they're drugs that look like candy. And, the thing is working in this field, I can tell you that the dealers and traffickers are not trying to sell drugs to our toddlers. This is all about money. This whole industry and is about finances. So our toddlers don't have any money, so they're not selling drugs to our kids that are so young. What I can tell you though is that I have a couple pictures I want to show you shortly of some fentanyl pills that were confiscated here in Snohomish County from our drug task force. They look like the Lucky Charm marshmallows. So while the dealers are not trying to sell to kids, um, they're in a plentiful supply, and there is a chance that if someone is using these pills, I have clients that smoke 60 to 70 fentanyl pills a day. So they have a plethora of them. And if they're at a park or they're out at a public space, at a bus stop somewhere, and they drop some of these pills, if a child comes up, what do little kids do? They put everything in their mouth, right? So there is a chance that looking at maybe one of these pills that looks like a Lucky Charm marshmallow, the child would put that into their mouth. That would be a chance that that child would experience an overdose. If a person forgets that they've taken their medication, this is something I can relate to. The older I get, usually by noon, I can't remember if I took my vitamin. But as we age, our kidneys and livers don't process medications the way that they did when we were younger. So there is a high chance of experiencing an opioid overdose. And if we're not managing our medications appropriately and taking them when we're supposed to, it can be really dangerous. If a person is experiencing more pain and so they take extra of their prescription, this is also an issue. Say you just had a knee surgery and it's like, I have 1 hour until my next pain pill. So I'm going to take my pill an hour early, but then I'm going to try to push it out on the other side in order to, get more relief, right? When we start manipulating those time frames, it puts us at risk for an overdose. Now, if a person hasn't used an opiate or an opioid in more than a few days, there is a high likelihood that they will experience an overdose when they go back to using. So this is probably the most frequent individual that I work with is, see, I spend a lot of time in Snohomish County Jail, well, working in the jail. So I'm working with an individual and we're trying to set up a plan for next steps. If they get released prior to our plan being set up and they go back to using the same amount they had when they got arrested, if it's even only been a few days, their tolerance has gone down so quickly that there is a chance that it will be too much and they would experience an overdose. This is also true for someone who is maybe looking for treatment options and say they went to detox and they're waiting for their treatment bed to go to treatment and there's a few days in between, and if they use between that time frame, there is a chance that there would be an overdose. And then if a person combines an opioid with another drug, especially alcohol or a benzodiazepine such as Xanax, Those are also respiratory depressants, and so that compounds the chance that there would be an overdose. Do we have any questions so far, Alicia? Doesn't look like it. Okay.
No, not yet.
Okay, thanks. So let's talk about opioid use disorder and addiction. So everybody's probably familiar with tolerance. So tolerance is when a person uses a substance and they have a reaction. They have an effect from that, right? As time goes on, they need to use more and more of that same substance to get that same initial effect. So, for example, my daughter, who's just turned 21 in May, a student at Arizona State University. I'm sure it's the first time she drank a beer back in May. She drinks a beer and has an effect from that. As time goes on, she would need to drink another and another and another in order to get that same effect. It's the same thing with opioids. The problem is that the physical dependence comes on so quickly with opioids. Physical dependence is when you continually use that substance and your body becomes dependent on it. So if we were to all leave right now and go to, let's say, Providence Hospital, and Providence Hospital gave us all a prescription, each of us to take as prescribed for the next 2 weeks, and we met back here in 2 weeks, every single one of us in this room would be physically dependent on that opioid. Now, that does not mean that we have an opioid use disorder. What it means is the next day when you don't take that prescription pill, you're going to feel a withdrawal effect and a negative effect, and it's not going to feel very good. This is the same thing though with, say, a blood pressure medication. If you take a prescribed blood pressure medication and you just quit taking it, there will be a negative effect from that, right? The crossing over to substance use disorder or addiction is when the use of that, whatever the substance is, for example, tonight we're talking about opioids, you continue to use those opioids even though it's negatively impacting your life. So there's going to be failure to meet work obligations. Maybe school is a struggle, legal consequences, family relationships, friends, all of these things are negatively impacted by the use of an opiate or opioid, and yet the use continues. So that's where the difference is between the physical dependence and then crossing over to the addiction. So I want to show you what it looks like when someone experiences an overdose. We all have opioid receptors throughout our body. We're going to focus on the ones that are in our brain, and we're going to pretend that they look like these little corkscrews. So as shown in this picture, we all have these in our brain. When we use an opioid, as reflected by the red dot, they sit on these receptors in our brain. Okay. Now, when all of these receptors are full, you stop breathing, and that's when you experience an opioid overdose. So we know that the overdose deaths have increased drastically in the last 5 years in Snohomish County. Um, they have dipped a little bit, and I'm going to show you some national numbers in a few minutes, but there's still too many. Last year in 2025, between Swedish Hospital and Providence, there were 796 opioid related events that went through the emergency room doors. Now, that is down from the year 2024. That number was 977. What I can tell you though is that if someone experiences an opioid overdose, they are not required and we cannot force them to go to the hospital. And with the experience, and I can only speak for my own experience, but in my job, I would say 90% of the people that experience an overdose refuse to go to the hospital. So this number is very underreported and it's still really high, right? So just helping understand that yes, the numbers they are coming down, but it's really hard to tell exactly where it falls. We know that fentanyl is currently the most common substance that's involved in fatal overdoses. In 2025, there were 197 fentanyl deaths in our county, and there were 226 total opioid related deaths throughout 2025. So it's a lot. There is this website that I like to share because it is full of information. If this is something that you want to know what's really going on throughout Snohomish County, the Snohomish Overdose Prevention.com, they have a large amount of data, and it breaks down demographics throughout zip codes, gender, all these different things of who's overdosing, where it's happening, and just like I said, a lot of data. But one question I would like you to think about is if you had to guess, so we're going to say in 2022, what percentage of opioid overdoses that occurred were people who were also experiencing homelessness? So just think about that. If and we're talking about 2022, what percentage? Now I said 100% because that's my caseload, right? But in 2022, 57% of opioid overdoses that occurred in our county were in a private residence. So this is not just individuals who are experiencing homelessness or people we drive by on the street or what we see on the news. What is portrayed of who's overdosing is very inaccurate, especially in the media, because like I said, 57% were in a private residence. That number is down in 2025. It came down to 48%. But again, that is almost half of the overdoses that are occurring in our county are in a private residence. So this is, neighborhoods, communities, families, like people that we come in contact with. So being able to talk about opioid use disorder and navigate the resources and helping people understand that we aren't just judging and putting this stigma on them and helping them is really important for people to access help. So we know that the local use of Narcan is increasing. So last year, in 2025, 74% of those 796 individuals that went through the hospital emergency room had already been treated with Narcan, which is great. Up to 23% of the time, it was by a community member, a friend, family member, or a bystander. Um, I want to make a note that I've done this job long enough to know that I can't force someone to stop using drugs. I can't make my client stop using. Narcan that's not the tool. That's not what Narcan is used for. Narcan is helping them stay alive so that they can make that decision to do something different, right? Um, if someone is dead, they can't get any help. So this medication, again, is just to administer and then help them so that they survive. So looking at national overdose deaths, this is from 23 and 24. Like I said, the CDC is showing like a 24% decrease in 2024. It was like 21.5% last I saw for 2025. But it's still way too high. Yes, it went down from all drug use, 110,000 down to 80,000, but these numbers are still way too high. Yeah, so we've got to get the people to help. Before we go through the steps of how to administer Narcan, I briefly want to talk about what you can do to prevent an overdose. It's really important to keep our medications that we have in our home up high, out of reach from children, and also, locking them up. So the little pill bottles that we get from the pharmacy, those are not childproof. We like to refer to them as adult proof. I do have these medication lock bags, and I will be happy to bring some when I bring the Narcan up to Stilly Valley. If you have medications, it doesn't have to be opiates or opioids, but medications that are managed in your home, please take one of these. It's just another way to keep people safe. Um, I worked with a kid who told me that he had stolen his stepdad's heart medication to take to a party because they didn't know if that would work to get them high or not. So again, it doesn't have to be an opiate or opioid. If, keeping these medications locked up is really important. I also had a woman share that she had a large family gathering over the holidays for a dinner, and there was a lot of extended family that she didn't know, and she had run upstairs for something and found her second cousin rifling through the medicine cabinet in their upstairs bathroom. So again, it's not necessarily our kids or, our direct family members or friends, but people in and out of our homes, keeping our medications locked up, it just creates another level of safety. So again, I will bring some of those as well. So what can we do to prevent overdose? We can also get rid of old, expired, and unused medications. The important thing is that we don't just flush medications down the toilet or throw them in the garbage. We do have a National Drug Take Back Day, which actually Stilly Valley is supporting up at Smoky Point Behavioral Health. And it is, I believe it's the 27th or the 25th, whatever the last Saturday in April is. And I'm sure Alicia can remind us at the end. But that will be a place that you can go and take back medications that are expired or unused. Again, just getting them out of the house is just another way to keep people safe. If you can't make it on the day of the take back, most police departments and most pharmacies have the drop boxes, and you can go dispose of them there, and then they will get rid of them appropriately. So, information about Narcan. Each kit contains 2 doses. Okay, so this is what they look like. Expiration is usually about 2 to 3 years, and it is best kept at room temperature. So initially they felt like, and told people don't keep it in your car because if it hits extreme high temperatures or extreme cold, excuse me, it can cause it to lose its efficacy. But what they're finding now is that it's more important to actually have the Narcan with you in case you need it. So if it's sitting at home on your counter and you are somewhere else and see someone that needs this medication, that's not going to be helpful. So again, if you do know that the temperatures are going to dip below freezing and you think of taking it out of your car, that is best practice. This medication will freeze and it takes about 15 minutes to thaw. So if you were driving somewhere and needed to access it, it wouldn't work if it was frozen. So you're going to learn how to recognize an opioid overdose and respond. Ultimately, again, our job is just administer this medication to help the person start breathing. We want the paramedics, the first responders to come and take over and ideally get the person to the hospital. How do you know though if someone is actually overdosing or they're just really high? Sometimes it can be hard to tell. So if someone is experiencing an overdose, their skin will be pale and clammy. They're breathing, they're probably not breathing. If they are, it's going to be very infrequent and they'll be making a snoring sound or a gurgling noise. Excuse me, sometimes people refer to it as the death rattle. They have a slow heartbeat, slow pulse, blue lips, blue fingertips, or an ashy color. But the biggest tell is that they're not responsive to any type of stimuli. So if you're shaking them and they're not responding, you can do the sternal rub, which is your middle knuckle. You put the middle knuckle up and then you rub on the sternum. It's really uncomfortable. And believe me, your adrenaline is going when you think someone is overdosing, and so you don't do it softly. If they don't wake up with that sternal rub, then you want to get your Narcan. Let me just look and see if we have, oh yeah, perfect. Oh, here. Perfect. So how does Narcan work? This medication goes into the brain and it knocks those opioids off of the receptors and it gives that person a chance to breathe. Okay. It'll start working within 1 to 3 minutes and it lasts for about 30 to 90 minutes. Now, Narcan cannot be abused. It can't cause an overdose. And people are not allergic to it. If someone is given Narcan and they are physically dependent on an opioid, it will throw them into acute withdrawal. So they will experience vomiting, nausea, muscle discomfort, chills, very described as the worst flu you've ever experienced. Okay. So they might try to tell you they're allergic to it, but it's actually just because they're physically dependent and being thrown into withdrawal. I want to make a note here that if there was a child that, say, picked up one of these pills and ingested it and was experiencing an overdose, if you gave that child Narcan, they would not experience any of these side effects. Okay, they're not physically dependent on that drug. It is an accidental overdose, and so they would just start breathing. So here's what happens. Let's say you walk out into a parking lot and you see someone is down. The first thing you're going to do is you're going to ask them if they're okay. They're not responding. You know something isn't right. So before you do anything, you need to call 911. Call 911, let them know that you have Narcan, that you think that this person is experiencing an overdose, and your location. A lot of times the dispatcher will ask you to put them on speakerphone so they can provide an additional support to you as you're going through the steps. So ideally, when we administer the medication, we want the person to be laying on their back. So if we can, roll them so that they're lying flat on their back, and we do the sternum rub. Okay. They don't respond. So you get your first kit, or excuse me, your first dose. Now these are in a blister pack. So you don't want to test the medication. This medication is a one and done. So don't test it to see if it works because you'll lose the medication. So we have the person lying flat on their back. We're going to insert this into one of their nostrils all the way until it hits the tops of your fingers, and you're going to press the plunger. So I'm going to hold it so you can see. It's kind of hard to see online, but you can see how high this goes, right? They're not breathing, so they can't sniff like it's Afrin or Flonase to get that benefit. What happens is it starts absorbing through their nasal epitheliums and it will start working. So at this point, we've administered one dose. What we want to do is after we've administered this dose, we want to roll them into the recovery position, which is onto their side, because when they start vomiting, we don't want them to aspirate. Now, if you are CPR trained, um, before you roll them into the recovery position, you can do chest compressions. There are multiple ways that people do training. Sometimes people train for rescue breathing. The doctor that oversees our program believes that best practice is the chest compressions because it starts kind of priming the pump and it gets the medication going through the system. Another note is that a lot of times people don't always have a face shield. And if you're administering, this medication to a stranger, you may not feel comfortable doing mouth to mouth. So ideally, administer the medication, a few chest compressions if you're CPR trained, and then roll them into the recovery position. Now, if they don't respond or start to wake up, you're going to wait for about 3 minutes. It's going to feel like an eternity. If they haven't woken up after 3 minutes, we're going to roll them onto their back again, and we're going to administer our second dose in the opposite nostril. Okay. At that point, it's been at least 6 minutes since we've called 911. So hopefully the paramedics will be arriving and they'll be able to take over. If you have more than one Narcan kit, you can continue to administer this medication every 2 to 3 minutes until the paramedics get there. With fentanyl, I've heard of 7 being the most Narcan doses being administered to someone because it's such a powerful opioid. But not everybody has access to 7. So just keeping that in mind, just use what you have and then wait for the paramedics to arrive. Let's see if we have any questions. All right. So again, when we roll someone into the recovery position, just a reminder, be prepared for vomiting. You may have seen on a TV show or online someone waking up from an opioid overdose and they're very combative. Irrational behavior, short temper. Here's the thing, when someone experiences an overdose, they have no idea they overdosed. The last thing that they know is they were using a substance. Now they're waking up, feeling terrible, cops, paramedics, and strangers standing around. So they're a little irritable, can be a little irritable. They don't really understand or comprehend what is going on for the most part. So just keeping yourself safe is always the most important thing. But just being aware that it's typically not the combativeness. A lot of times people will just walk away rather than become frustrated. So what happens when we administer the naloxone? You administer the medication, it goes into the brain and it knocks those opioids off of the receptors and it sits on the receptors. Okay. Now, It's blocking the receptors, but remember I said this medication lasts for about 30 to 90 minutes. You can see that the opioids are still in the person's brain. So as this medication starts to dissipate, there is a chance that those opioids could reattach to the opioid receptors, and that person could experience another overdose without using a substance again, right? So that's one of the most important reasons why we really want people to be seen by a doctor or go to the hospital, because they need to be monitored to make sure that this doesn't happen. But as you can see, the medication goes in and it sits on the receptors. And then when that happens, the person is able to start breathing again. All right, let's talk about fentanyl, unless there's any questions that I need to address before we continue.
Hey, Amy, there was one question that I think you covered a little bit, but I think is really great for people to remember. The question was, what effect does Narcan have on someone who isn't experiencing an opiate overdose?
It's a great question. Thank you for bringing that up. Absolutely nothing. There is no effect. So if you were to come across someone who was you thought was experiencing an overdose and you gave them Narcan, you then find out they were actually having a heart attack. It's okay. The medication, Narcan, is not going to do anything to harm them. Now, it won't help them in any way, but it won't harm them. And we're going to talk about the street supply of drugs right now, especially with fentanyl. But I do want to just make it known that if you see someone that's maybe overdosed and they have maybe some Xanax pills next to them, so you think, oh, my Narcan's not going to work, it's probably laced with fentanyl. I would always err on the side of administering the medication if you're in doubt, because again, there is no side effect. If you're not using opioids, nothing happens. All right, so I wish we were in person so that I could pass these around to you to show you. It's hard to see online, but I have some visuals of a lethal heroin dose versus a lethal fentanyl dose. Fentanyl is a powerful synthetic opioid it's similar to morphine, but it's 80 to 100 times more potent, and it's about 50 times stronger than heroin. So it does the same thing in the brain, it's just much stronger. With that being said, there is a lot of misinformation about fentanyl, especially in our media. Excuse me. So we're going to talk about if we were all together, I would give you these cards and we could do true or false, but we're just going to have to, you're going to have to play by yourself. So the question, I'm going to read the question and then think about what you think the answer would be, and I will let you know. So the first one is fentanyl is often described as 80 to 100 times stronger than morphine or about 50 times stronger than heroin. That is true. And I know that I just said that, but you would be surprised. Sometimes in the room, someone maybe wouldn't be listening, and I've seen false come up with that. So again, it is an opioid, very, very strong. Number two, fentanyl overdoses cannot be reversed. False. Um, it might take 7 doses of Narcan to bring the person back. But again, fentanyl, even though it's so strong, it does the exact same thing in the brain and it sits on the same receptors. Fentanyl is an illegal drug. It's both. It's true and false. So fentanyl was created for the medical community in a hospital setting where it is administered through an IV as a liquid, for very severe traumatic injuries, surgeries, people who are dealing with cancer. Fentanyl is legal when administered in a hospital setting. If it is written as a prescription, it would be a transdermal patch, a lollipop, or a tea bag. So what is illegal are the fentanyl pills and the fentanyl powder. So there is no such thing as a legal or real fentanyl pill. They are made to mimic, to look like other pills I'm going to show you in just a minute. But again, if you are given a prescription for fentanyl, it would not be a pill or powder. Fentanyl is currently moving through our street market. It comes in a powder form that can be injected, smoked, or snorted. It's also been found in other drugs like heroin, meth, cocaine, pressed pills, Xanax, Adderall, all of the above. Yes, that is true. It is safe to assume that fentanyl is in every street drug. Um, it's a really hard time to be a kid right now, because adolescents there's no room for experimentation. Unfortunately, this drug is so strong that kids and people are losing their life, thinking that they are taking something that they are not. And finally, you can overdose just by touching fentanyl. False. This is not true. There is a perception out there that, and especially through the media, actually, my 16-year-old nephew told me that he wasn't helping his mom grocery shop anymore because he saw on the news that there was fentanyl on the grocery carts. So I told him he can continue to help his mom grocery shop and then he can wash his hands if he wants to. Um, if I had a pile of fentanyl powder sitting right here and I stuck my hand in it, I am not going to overdose. Now, I don't want to put my hands in my mouth, up my nose, in my eyes, right? Or if I had a large open wound and it got in there, then maybe there could be an overdose. But just by touching fentanyl, there are no confirmed overdoses. Um, with that being said, I don't want to downplay the toxicity of this drug. It is very dangerous. The problem is that with this idea that, if you touch it, you're gonna, potentially lose your life. People aren't willing to help other people, and it's just misinformation. Even a prescription for a transdermal patch of fentanyl, that those are created to absorb through your skin, and those take 2 to 8 hours to actually start absorbing and working on your skin. So the actual powder and pill does not cause an overdose. And we're going to talk more about that in a minute. I was telling Alicia prior to the training, I do have a safety briefing from the Snohomish County Health Department that I am going to send to her so that when she sends out information about this training, I'll have her attach that so that you can access all this information. And we will go over it briefly, but just for some more information. A couple of pictures, a lethal dose of fentanyl, the tip of a pencil for someone who doesn't use opioids, very dangerous. So this picture, one of the deputies that I work with had just arrested this gentleman, and I made him stop because I wanted to get a picture of this because this gentleman had said, "Well, this is this fentanyl powder. This is for my own personal use." So that is deadly right there. But this is what the powder looks like on the street. I will tell you also that what the drug task force, what we're finding on the streets is cocaine is making a really big comeback right now. Um, and it looks a lot like fentanyl powder. So there have been a lot more, there's been an increase in overdoses of people thinking that they're using cocaine when it's actually fentanyl. And then it's been fatal. These are the street pills that are sold. They're referred to as blues or perk 30s or fentanyl pills. They are mimicked to look like a Percocet 30 milligram pill. Um, and these are extremely dangerous because they are made where there's no oversight or any process that is safe. They essentially create these pills and you don't know what you're getting. So, for example, let's refer to them as chocolate chip cookies. A good chocolate chip cookie has like 30 chocolate chips in it, and a terrible one has two. One of these pills could have 30 micrograms of fentanyl in it, and one of them could have two. So, you have no idea what you're getting. And that's why they have become so fatal. I did work with a young man who was not a drug user. He was an 18-year-old student over at Central, and he had come over to this side of the mountains for a friend's birthday. And one of his friends had gotten one of these pills and said, "Hey, do you want to split this pill?" I mean, it doesn't look dangerous. It's not like smoking a substance or using a needle, right? So he said, sure. So they split the pill. The gentleman I worked with overdosed on his half of the pill, and the other kid did not. So what they find is that half of the pill may have more fentanyl than the other side, right? You have no idea and no way to know what you're getting. And that's what makes them so dangerous. These are the Skittles and the Lucky Charm pills that I was telling you about. These aren't as popular, but I think it's really important to see. I just heard last week that there were some fentanyl pills that were blue and green, which is different. We hadn't seen those recently. But these pills, the Skittles, they're the same pills I just showed you, but in different colors. And then again, the Lucky Charm fentanyl pills. Like I said at the beginning, this is all about money, right? So people, they have a product that they're trying to sell. So they want you to come back. So if they have a distinct look for what they're selling, you're going to seek that out. So um, people ask often, like, why do they sell them? Why do they look like this? Why are they different? And again, this all comes down to money. Okay, so the fentanyl exposure safety briefing that I'm going to share with you guys, we're going to talk briefly. We talked about the fact that you can't overdose just by touching fentanyl. There are also no clinically confirmed overdoses from secondhand smoke. People who smoke fentanyl, actually, the concentration of that drug is is absorbed by their lungs. So any secondhand exposure, um, now it it can cause a negative effect if you're in around someone who is smoking it. For example, headache, feeling dizzy, maybe nauseous. But there again have been no clinically confirmed overdoses from secondhand fentanyl smoke. I'm wondering if anybody who is on this training has seen the uh, reels and the things that we are shown, the videos of especially law enforcement being confronted with maybe smoke and then experiencing an overdose. Back when fentanyl was first coming on the scene, that is what they thought was happening. What they're realizing is that individuals in those situations are have been experiencing a medical emergency in the fact that it is either a panic attack or an anxiety attack. The most recent, it was a TikTok that I saw. It was a South Carolina officer, and she had opened the door of someone, and the secondhand smoke had hit her. She did have a medical reaction to that. However, she was asking for Narcan. And if you're experiencing an overdose, you cannot ask for Narcan. You are completely out. So it was really interesting. Again, I feel like through social media and just the regular media, it can be a real scare tactic, and it unfortunately inhibits people from wanting to help others. So, and again, I've got the safety briefing to share with you and happy to answer questions about that. Again, if you do come into any contact with either those pills or some powder, it is important to wash your hands immediately. And the best practice is with soap and water. If you don't have nitrile gloves to get rid of them or, get them out of wherever you are, then you want to wash your hands soap and water. You want to avoid any hand sanitizer. Um, uh, a lot of times those contain bleach or alcohol, and that would actually cause it to absorb a little bit more quickly into your skin. So you want to stay away from the hand sanitizer. And also avoid touching your eyes, nose, or mouth. Um, if you are in a situation where someone is smoking fentanyl, an N95 or an N100 mask is would be the best protection to have if you're in that environment. So the Good Samaritan naloxone law for Washington State says that if you come across someone who's experiencing an opioid overdose and you give them Narcan, there are no civil or criminal liabilities that can come against you. So you are protected. If someone is physically dependent and they feel terrible after receiving Narcan, and they say they're going to sue you, they're not going to sue you. There's nothing that can come against you for administering this medication. The second part to this law is for individuals who are using together. There was a period of time where people were afraid to call 911 if someone overdosed because they didn't want to go to jail. This law protects that. So if two people are using, one person overdoses, the other can call 911. They will take the drugs, the paraphernalia. If they have a warrant, and they may go to jail, but there will be no new charges for either person involved. Um, but they are likely to receive Narcan if they didn't have it and get the help that they need. So again, you don't need a prescription from your doctor to get this medication. It is sold over the counter. I will say that a lot of providers now, when they do prescribe opioids, are also writing a prescription for Narcan, and that could be covered under your insurance. So a lot of accidental overdoses happen, especially as I was talking earlier about as we age. So um, it would depend on your insurance plan, if it's covered or not. But the other thing is that it is covered by Medicaid. So I encourage all my clients to carry it, even though I know that you can't administer this to yourself if you're experiencing an overdose. But if you have it with you and someone finds you, then there would be at least a chance that they would be able to use it. It is sold, like I said, Amazon, Walmart, CVS, most pharmacies have it. And again, it's about $45 to $50 per kit. Um, and then like I said, I'm going to bring free Narcan to anyone who's on this training that would like to go pick it up from Stilly Valley. But if you aren't able to do that, there is a resource here. It's the phra.org/naloxone. If you go to this website and you enter your name and address, there's a box if you click to determine if you want the nasal spray or the injectable form, and they will ship it free directly to your house anywhere in Washington state. So this is also a good resource for people, maybe if you have family or friends in another part of the state that don't have access to free Narcan, they could go onto this website and they would receive it in the mail. And that concludes the training. So now, if there's any questions, I would be happy to answer them.
Yeah, two questions came up. One of them being, can Narcan be used on a dog or an animal if it eats an opiate pill?
Great question, and absolutely. It is a very safe medication. Actually, one of our drug dogs at the sheriff's office overdosed a couple springs ago, and he was given two Narcan doses, and he did have to go to the vet, but he did survive. So, yes, this is also really important if you have pets that you walk outside. It may not even be in the house if it came across a pill, but sniffing, there are things out there. So yes, please use it on, and it's the same thing. They won't experience any of the side effects either.
Yeah. Another question was, why is cocaine a stimulant mixed with fentanyl a depressant? Is it a more intense high?
That is a great question. There used to be, before cocaine started making its comeback, they were mixing methamphetamine and cocaine, and they referred to them as speedballs. So it would be a very intense high, and it would be very different because I've worked with a lot of people who say, well, I just use methamphetamine, right? But they're testing positive when they do give a UA. For fentanyl also because it's been laced. So the way that they experience their high has changed. And then they become so dependent on the fentanyl so quickly that they need to continue to seek out that fentanyl when they thought that they were just using the methamphetamine. So a lot of times people who are using cocaine as like a recreational drug are not interested in using fentanyl or opioids. And that's kind of the problem, is that getting it mixed up, is that people are assuming that it's going to be this one specific thing, and then it's not. So, yeah, it is very interesting. It does wreak havoc on the body when we've got the depressant and stimulant going at the same time. Yes. Good question.
Another question came in, can a high school student carry Narcan on campus during the school day?
That is such a good question. I wish I had a definitive answer for you. It depends on the school district. What I can tell you is that 2 years ago, Senate Bill 5804 passed in the Senate, which required every school district in Washington to have Narcan on site. So prior to that, it was just school districts that had over 2,000 students. So now I can guarantee that every school in Snohomish County has Narcan because I've trained them all and given them all Narcan. When I've done these trainings at schools, um, it's hard because a lot of the schools have rules that you can't, carry ibuprofen or you can't have anything on you. There was an incident not long ago at one of the school districts locally that the adolescent had been carrying Narcan. She had a family member that struggled with opioid use disorder. They did take the Narcan and then after figuring out what was going on, gave it back to her. So I think that it really, it's going to depend on the school. And for me, if it was my child, I would absolutely, I would figure out if they can and how to make that happen.
Mhm.
Yeah.
Thank you. Well, if there's any last minute questions, feel free to put them in the chat. But I wanted to thank everyone who joined us for this class. As you leave today's webinar, a quick 6-question survey will appear on your screen. We would love it if you could take a minute to let us know what you thought of this class and to share any feedback or suggestions for future classes. This is recorded, so you will be receiving that information here in the next coming days. And then Amy did mention that in April, Stilly Valley Health Connections is helping host a April Drug and Vape Take Back Day and a mini resource fair. So that will be on Saturday, April 25th from 10 a.m. to 2 p.m. at Smoky Point Behavioral Hospital. Amy, I believe you're going to be there with some Narcan and possibly some bags. We have some other resources and some really valuable information education for the community. So feel free to join us for that. But it looks like that is all we have for now. So thank you all for attending, and I hope to see you at future classes.
Thank you.